Welcome to the knee exam. We start off with inspection of the knees while the patient is walking, so the gait. While sitting down, we're looking at swelling, ecchymosis, muscle atrophy in the quad, malalignment, scars, open wounds, zoster vesicles. After inspection, we're looking for infusion, milking the fluid. We're looking for filling of the dimples on either side of the patella. Another is the ballottement sign, and here the patella, you will feel a bounce or quick moving up of the patella once you press it down. Do active range of motion. If there is any difficulty, you then do passive range of motion with resistance. Test motor strength. Look at the heel to butt distance. Next is palpation. Quadricep tendon, patellar tendon, proximal, signs of Shindig-Larsen. Distal is Osgood-Schlatters. Around this area you can also have tenderness of any infrapatellar bursitis. Any tenderness on either side of the patella inferiorly could be fat pad syndrome or Hoffa's disease. Palpate medial joint line, the anterior horn of the meniscus, the posterior horn of the meniscus, and the medial collateral ligament. Just going inferiorly, the pes anserine bursa, again the anterior horn of the meniscus, the posterior horn of the meniscus, and the lateral collateral ligament. Palpate the fibular head and the IT band. Moving to the back, you want to palpate for tendons of the hamstrings, which is the semitendinosus, the semimembranosus here, and then the biceps femoris. Palpating for any sort of Baker's cyst. You want to test neurovascularies, checking for pulses, the dorsalis pedis, the posterior tibialis, any sensation on either side of the leg. When a patient has knee pathology, you also want to test the hip and the ankle, because that could be referred pain, active flexion of the hip, and passive internal-external rotation of the hip. Testing for flexibility of the hamstrings, the quads, and the gastrocnemius, as any abnormality in flexibility can aggravate any knee pathology. There are special tests for each diagnoses. Patellar pathologies, there's the patellar compression test. Here we just press down and a positive sign is any pain. There's the patellar apprehension test. Any apprehension, subluxation, or pain is a positive test for dislocation or subluxation of the patella or medial retinaculum pathology. Tests for the collateral ligaments. There's the valgus and the varus stress test. This is done both at 0 degrees and 30 degrees. If there is laxity at 0 degrees, it means there's more damage than just the collateral ligament. The tests for ACL damage, the Lockman test, which is the most specific of the tests. Here you're looking for any laxity. Obviously you're comparing to the normal knee. The anterior drawer test, once again you're looking for laxity. And then there's the pivot shift test. This test is a little bit more difficult to interpret. Here you're internally rotating the ankle and you're having a valgus force flexing the knee. At around 30 degrees, you should feel a clunk or a subluxation, and that would be considered a positive test. Next is tests for the PCA, which is the posterior sag sign. Here you're comparing the abnormal knee to the normal knee, and then there's the posterior drawer sign. As for meniscal tears, the Sallies, this is formed standing up. The patient flexes the knee in question to about 15 to 20 degrees and twists. Pain or catching or clicking is a positive finding. This is considered the most specific and sensitive compared to the others. McMurray's, basically what you're doing is trying to load the compartment and reenact the forces that cause the tear. Medial compartment, externally rotate the foot and put varus force and full flexion and extension. And then for the lateral compartment, it's the opposite. Internal rotation and a valgus force along with flexion and extension should cause a click, a catch, or pain. There's also the Appliqu compression test. Here the patient is on his stomach. You flex the knee to 90 degrees and you put a compressive force. The last test for meniscal tears is the bounce test. And this basically tests for any intra-articular pathology with meniscal tears in particular. Next is the test for IT band pathology, the Noble's test, which is performed here, and the Ober's test. A positive test is the leg staying above the plane of the other leg or any discomfort. And finally, the last test is for posterior lateral corner pathology, and that is the dial test. Pain is a positive finding.
Dr. Jeff MD here.
Dr. Andy Chatterjee.
I hope you enjoyed our video. I have a passion for sports medicine, so I put all my heart into these videos, so I hope you like them. Subscribe as much as you can and share it with your friends. We'll see much more.
We'll see you later.
Bye.